From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Good afternoon, folks. This is Dr. Paul. Thank you very much for tuning to our channel today. Today I want to talk about premenstrual syndrome. You see, premenstrual syndrome is a very common problem, and mostly it happens during the luteal phase of the menstrual cycle. It can cause affective, cognitive disturbances, alterations in appetite, fluid retention. So remember, this is a group of disorders and symptoms occurring during the luteal phase of the menstrual cycle. And the problems can include anything from affective disturbances to alterations in appetite. There could be cognitive disturbances, fluid retention, and pain. And it can affect a lot of women. And in 40% of women with PMS, the symptoms are significant enough that they interfere in their daily lifestyle, and it can impact their relationships. In 5% of women, actually, we see severe impairment that cripple their life. And so this is a very common problem, and it happens during reproductive years and can last until the menopause. So you need to evaluate them and diagnose them and treat them very, very carefully, because a misdiagnosis can impact your treatment plan, and many times doctors use counterproductive treatment modalities with harmful effects. So very carefully this has to be treated, folks. That's my point. Now, the doctor should be sensitive when you address the problems. Many women suffer from low self-worth, frustration, depression, anxiety, and the difficulties with their spouse and children because of this problem. And many times they can't even describe it. So think of affective problems, cognitive problems, and physical problems. These three things happen in PMS. And so you see, you look for these symptoms: affective, cognitive, and physical. There can be irritability, there can be bloating, and many women suffer from depression and food cravings and aggressiveness and mood swings. And there is a classification called Abraham's classification that helps you to organize your history and a physical examination and a treatment plan. So let us see Abraham's classification. In Abraham's classification,
Alright, he's vomited 7 times today, but it's not...
Okay.
It's more of the, dry heaving, yellow, phlegmy stuff.
Yeah.
So when you saw, I didn't want you to see 7 and be like, oh my gosh.
Okay, thank you. So you see in these patients dizziness, fainting, depression, forgetfulness, crying, confusion, insomnia, and also anxiety, weight gain, and swelling of extremities, breast tenderness, and abdominal bloating. So affective disturbances, cognitive disturbances, physical disturbances. These are the 3 things we need to look for and evaluate for risk factors like alcoholism, smoking, and obesity, and financial problems. Those are the risk factors, and patients with those problems are more likely to get PMS. And when you do physical examination, look for any weight gain, fluctuations, and fluid retention, breast tenderness. Because the symptoms are so diverse, there is not a specific physical signs and symptoms diagnostic of this problem. The same thing can be said about laboratory or radiologic tests. Because the symptoms are so diverse, there are no specific lab tests that will help you to identify PMS. Now, a few words about treatment. Education, folks, that's very, very important. You need to educate. You need to give empathy, psychological support to these patients, because the symptoms will last for months and months, even when you start them on certain treatments. So therapy, it should have that integrative approach, whether you give education, psychological support, exercise, dietary modification, and you start them on medications. And there are also alternative medications, which I am going to discuss in a minute. So you follow that integrative approach when you treat these patients. So reassure them, give them genuine empathy. That's where you start. And then you encourage them to be more social, where they can get some support. And you start them on medications also. And so start with dietary modifications, how much they are eating, what needs to be done, whether they need any diet supplements like calcium, vitamin D, proteins. Those are the important things. Or whether they have to cut back, because sometimes they eat more and become overweight. So what needs to be done there? And also exercise. A moderate exercise, at least 3 times a week, is important. And exercise increases their activity and helps them to cope with their psychological problems also. And for patients with continued symptoms, you need to give them other things, like dietary supplements if there is any nutritional deficiency. So that's important, folks. Some of them develop a magnesium deficiency, so give them magnesium. Some of them calcium deficiency, give them calcium. Vitamin B12 deficiency, give them vitamin B12. They get this pain and they use NSAIDs. And also GnRH analogs like nafrolin and leuprolide. They relieve symptoms. So GnRH analogs are important. They have anxiety, start with benzodiazepines like Ativan, that gives relief. If they have depression, anger, anxiety, then go for an SSRI. We have a bunch of SSRIs in the market today, like fluoxetine, sertraline, paroxetine, venlafaxine, citalopram, a bunch of them. So start one of them. And there is also bromocriptine. Bromocriptine is effective in reducing breast tenderness and fullness. And in alternative medicines, there are 3. Number 1, chaste tree berry. Chaste tree berry is one of the most effective botanical agents for the treatment of PMS. So chaste tree berry, and it increases the luteinizing hormone, basically affecting the action of progesterone. You see, PMS is due to hormonal imbalance, and that's how chaste tree berry acts. Then there is St. John's wort, and St. John's wort, it is useful in treating the emotional and dysphoric symptoms of the PMS. And there is thirdly ginkgo biloba. Ginkgo biloba, folks, it's improve that breast pain and tenderness associated with this problem. So those are the 3 alternative agents to treat PMS. Number 1, chaste tree berry. Number 2, St. John's wort. Number 3, ginkgo biloba. So folks, that's about PMS. Remember, it's a diverse group of symptoms and signs, common problem. No specific lab tests. Treatment is integrative approach. And those are the most important things you need to remember. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.